Hello, my name is Matthew Chavez, and this is my road trip project. I will be interviewing Detective David Alvarez from LAPD. My purpose for this interview is to learn more about law enforcement and discover the many different qualities you need for this occupation. I hope you learn from this interview as much as I did.
David Alvarez. I work for the Los Angeles Police Department. I'm a detective, and I'm currently assigned to the Hollenbeck Police Station in homicide.
Hello, David. I'm Matthew.
All right, nice to meet you.
I'm Nathan.
And nice to meet you guys.
We're just going to ask you a couple questions.
Sure.
How many years have you been involved in the detective agency?
I've been working for the Los Angeles Police Department. This is going to be my 22nd year.
How do most people enter this profession?
Growing up, obviously, like in my case, I grew up watching shows on television that were involved with law enforcement. Adam 12 was one of my favorite shows. You probably don't know that show, but it was back in the 70s. And I remember watching it and thinking, that's what I want to do. So after high school, I prepared myself and I worked towards that, and eventually, applying.
Okay.
But to become a police officer, somebody has to be at least 20 and a half at the time of applying. And then they have to turn 21 by the time they start the academy. Currently, they only ask that you finish your high school, so you need your high school, obviously, or GED. But in the near future, and even now, if you want to further up your career, let's say you want to become a sergeant, you want to become a detective, or lieutenant, or a captain, or above, or chief, you have to get your 4-year degree. So I suggest, because it's a large pool of applicants, that the best qualified person will get hired. So don't just say, I'm just going to finish high school and wait until I'm 20 and become a police officer. Continue going on to school, get your AA degree or your 4-year degree. Not only will you get a better chance to get hired because of your knowledge, you will also get an extra percentage pay if you show proof that you have your 4-year degree.
Do you have to have like a certain GPA when you graduate?
No.
What skills are you required on a day-to-day basis?
As a police officer, your main skills are going to be writing skills, communication skills. You need those. All the skills you are going to be taught in the academy. You're going to be taught the basic law, vehicle codes, penal codes. All that is going to be taught. But you're just going to learn the basic, and as you're training and as you're working on a daily basis, you're going to be able to work out those skills you need. Like I said, most importantly is communications and writing, because you're going to be writing a lot of reports.
Do you find your job exciting or more on the boring side?
Oh no, it's exciting. Like I said, every day is something new. As a homicide investigator, it's great because you get called out when a homicide happens, obviously, and then it works like a puzzle. You basically talk to every single person, witnesses, family members, friends. You pick up all the evidence, you process all the evidence, and then eventually you start working towards finding who did this.
Yeah.
So any particular job within the LAPD is exciting. Patrol, you're going to find that even though I'm working out homicide, I still remember and I still wish I could go back and work patrol, because it's exciting every day. Like I said, every call is so different.
Yeah.
So how would you describe the atmosphere in which you work with and the people with whom you work with?
Some divisions are kind of tense right now, especially with what's going on in the news as far as police brutality, the shootings that are happening. It's unfortunate because LAPD is seen as a big department, which it is, but there's usually a lot of movies involved with LAPD. So any particular state or any country, they will love our badge, and it's on the news all the time. So when something happens with another agency or another city or another state, they immediately focus on LAPD. So yes, it is tough, but that's you have to work with the community. You know, without the community's help, we cannot resolve the issues that are happening. Um, so is it tense? Yes. Now they just started this last year. Certain divisions are starting to wear a body camera. So a lot of officers feel like, okay, great, now everything's going to be captured. But what they don't realize is that actually is going to help, and it has helped officers when there's somebody claiming that they did something wrong, but yet the camera shows something different. So we are in the new era and the technology, because like I said, within the next few years, everybody's going to wear those.
Yeah.
The police cars already have those attached too, so you know.
So, thank you for your time, David.
Thank you.
You're welcome. And nice meeting you guys.
You too.
Hi, my name is Nathan Thomas, and this is my RoadTrip Nation project. And I interviewed a nurse, and her name is Leela Isaac, and she works at Foothill Presbyterian Hospital. And I interviewed her to learn more about her occupation and if I'm interested in the medical field. And I hope you learn as much as I
My
do.
name is Leela Isaac. I am working in Foothill Presbyterian Hospital in Glendora. My workplace is in recovery room. That I hope you guys know, right after surgery, we take care of the recovery patient. I've been over there for over 35 years right now. We do surgeries except open heart surgery. All other surgeries we do, bone surgeries, even including brain surgeries. All the surgeries we do the hospital and do the recovery right after according to the need.
So, how do most people enter your profession?
You have to like nursing. You have to like people. You are you always have to mingle with the patient's needs. You have willing to do help for people more than making it's a job or something like that. If you like people and if you're willing to help people, this is one of the excellent job.
How long have most nurses been on the unit?
Most nurses, if you Foothill, as far as I'm concerned, if they stay 5 to 10 years, it's very friendly, homely situation hospital. So we'll be there, most of them 10 to 35, 40 years. I am 35 years. My co-worker is right now, she's 10, but she been to the recovery room nurse was over 30 years. Another nurse is there close to 15 years. We like it.
Will I be on call if I accept this position? If so, what are the conditions of on-call duty?
Not too many people cannot be on call that department. Anybody is on call that department, it has to have a nursing degree, and at least after the nursing degree, 1 to 2 years experience in intensive care unit, and you have to take a special classes like a CPR, ACLS, PALS, that's a pediatric classes, several classes to take. Then you have to be confident to take care of the anesthesia patient when you come in, and then we'll train as an on-call. Especially on-call, you will be by self, 1 or 2 people. You don't have time to think. You have to be person to be critical thinking, and you got to take care of that patient fast as you can. You don't have time for it to wait. This is the experience is the motive, is the key. Yeah. Not you or not inexperienced people cannot work that department.
What skills are required in your position on a day-to-day basis?
Skills is, I just mentioned, like a bachelor nursing degree, then you take the intensive care course, then plus experience. Experience is the one how to take care when some complication comes, some side effects comes, how to manage the situation. That's very important, that department. It's not Every department has own issue. This one is anesthesia related complication. You have to do very fast, think very fast and react very fast. So not too many people can work that department unless you are experienced and well educated.
Do you find your job exciting or boring?
Very exciting, challenging, day by day, every day is a different, same procedure, different people act different, each individual is different. For you get general anesthesia, no complication, other person come in, everything complication. Older folks comes, they have like a heart problem, they have high blood pressure, and according to me, that's a very learning is never be boring. Sometimes it's mostly busy and exciting, challenging. To learn a lot about day by day, you can ask when you come in is very, this will, my interview will help you somebody, you make some decision, making a choice of a profession. You can be a nurse, you can be a doctor, you can do any health place, any job. I hope it helps. Thank you for interviewing me. Have a great day.
Thank you.
Thank you.
Thank you.